Hand injuries are common occurrence in any accident and emergency department. Because of the complexity of the anatomy of the hand, it is important to have a structured system of assessing an injured hand. A lot of conditions have been missed as a result of improper assessment of the hand injury at the time of presentation in the accident and emergency department. The aim of this study was to see the utility of using a pre-designed hand clerking sheet to assess emergency hand injuries. The aims of this study was to develop and evaluate a hand clerking sheet and find its usefulness in clinical merit and practicality in the acute setting. The hypothesis for this study was that the use of the clerking sheet will have no increase in the accuracy of documentation of the injured structures in acute hand injuries, the null hypothesis. However, the alternate hypothesis was that the use of this clerking sheet would increase the accuracy of the documentation of the injured structure in an acutely injured hand. This was the instrument that was designed by two experts who were hand surgeons to clerk patients with acute hand injuries. The material and methods, this was a retrospective match control observational studies where all hand injuries requiring acute surgical intervention were documented and followed for a 1-year period, and the final endpoint was the concordance of the assessment performed by the junior doctors either using the instrument, the clerk sheet, or generally based on their understanding of hand injuries, and the final outcome was the concordance with the intraoperative findings. These were the results, and it shows very clearly that there was adequate representation from both the control group, which was those who performed the assessment without the aid of a clerk sheet, as compared to those that used the new instrument, the designed hand clerk sheet. There was a significant improvement in the accuracy to 91% as opposed to only 61% for those who did not use the clerking sheet. This study therefore shows the utility and the usefulness of a hand clerking sheet. The implication of this for hand-related injuries is that the use of a designed clerking sheet for hand injuries improved its accuracy, allowed for a uniform description of the injuries sustained, is a useful aid for junior staff to assess hand injuries, and it also has facilitated the preoperative planning for the injured cases and provided speed and efficiency in the assessment of hand injured cases in the clinic, and it reduced the waiting time in the accident and emergency department. This study provides a framework for a structured assessment of acute conditions that appear in the emergency department. The limitation of these studies are that it is a retrospective match control and therefore has its own limitations. However, the other important limitation is the Hawthorne effect. That is, when the participants of the studies were being told of the study, they may have perceived this as a form of audit and therefore performed more meticulous assessment and documentation. Thank you.